OK, let's see how we got here and where we go from here. We'll take a broader look at the situation with Dr. Amish Dalja. He's a senior scholar at the Johns Hopkins Centre for Health Security. Welcome back to DW, Doctor. We're talking on a day when Germany's followed a number of other Western countries in intensifying and extending its lockdown after lighter measures failed. Are politicians generally too cautious about imposing severe restrictions, or perhaps only acting when they appear to have no other choice?
I think in many cases what we find are politicians being reactive. And you have to remember that lockdowns are an evidence of a policy of failure, because if you can test, trace, and isolate, like countries like Taiwan have done, you don't have to do lockdowns. But clearly we see countries, including in the United States, where we kind of go up and down, where we have cases go up and then they have a lockdown, they go down, but then nothing is done in between. There's no public health infrastructure built. There's no test, trace, isolate capacity. There's no home testing. All of that doesn't occur, and then cases inevitably go up. You have to remember, this virus is here, it's with us. So we have to come up with a sustainable approach and not usually trying to do blanket things temporarily and then not fixing the problem and then the same thing, repeating the same mistake over and over again.
So part of the German approach seems to be to try and get infection numbers down so that they can reimpose the test and trace system, put that back in place. But we get the good news, we get the vaccines, and then we get the worst news, we get the skyrocketing infections and death rates, and now more virulent mutations. So there seems to be a sort of cycle, inevitable cycle to this.
Right, and I think it's not surprising when you look at this virus. We know that coronaviruses can transmit efficiently, and now we're about a year into this pandemic. So I think it's really not the case that this is the only tool that politicians can run for is a lockdown. I think you have to ask, what did they do all of these 12 months? Why isn't there test, trace, isolate capacity in many countries? This was all predictable. We knew that this was going to continue to plague us, and I think many countries thought magically that this would go away or that they would be able to control it. But a virus like this is unforgiving, and if you don't have the public health infrastructure to keep cases to a manageable level, if you don't have enough contact tracers, if you don't scale up vaccination fast enough, this same cycle will continue to repeat itself over and over again, and it is not sustainable.
So let's talk about then lessons learned, because one has to wonder, what do you think is the biggest lesson that we need to take from this pandemic in order to prepare or prevent the next?
It's being proactive. This virus appeared in China, it was discovered in China December 31st, 2019. And most of the world gave the virus a major head start, at least until February or March, before they started to act. If you give a virus that has efficient transmission capacity, that level of a head start, you're going to have undetected chains of transmission that put your hospitals into crisis. So you have to act very rapidly when a new virus is identified to make sure you have hospitals fortified, that you have tests, that you start vaccine development, that you have enough personal protective equipment. But no country really did that except for a few Asian countries. And I think that's the lesson, is that if you don't follow the tried and true principles of pandemic preparedness, you will be hit hard. And we can't let this happen with the next pandemic. We have to move into action very quickly with targeted public health interventions.
Right, let's hope the lesson's been learned. Thank you for talking to us, Doctor. Dr. Amish Dalja from the Johns Hopkins Centre for Health Security.
Thank you.